Professor Francois Venter is a doctor who has lived through HIV for the past 2 decades with his patients. He's also the director of Izincha at Wits University and joins us now. Francois, thanks very much for making the time to join us today. Does making medicine easier to access necessarily lead to patients taking it more consistently?
Yes, I think that just making the whole transition from knowing your diagnosis to learning your status in terms of access to the medicines, and then just being able to pick up your medicines. That whole transition is really important. Easier is really important, and we've learned that getting your diagnosis fast, starting the treatment usually on the same day in South Africa, and making you get your medicines from somebody who knows what they're doing, and then picking up the drugs in the same place near your home actually facilitates people taking their tablet. And we've got millions of people now successfully on therapy because of that.
So take us back to that time before nurses were allowed to prescribe antiretroviral drugs for HIV.
So when the state program started on the 1st of April 2004, it's like yesterday still for me. We started initially in hospital clinics. Doctors would initiate the therapy. There'd be quite a big deal about adherence in many parts of the country. People would often come back for months before they were started. And there'd be a big song and dance in terms of the starting. Lots of blood tests, lots of adherence visits. And then when patients were ready after they'd been diagnosed and they come back a couple of times, they would have their drugs prescribed by a doctor. And then they'd come back several times as the drugs would take hold, and finally they'd get a couple of months of therapy and 3 months at a time. And finally, in some places, they get it up to 6 months at a time. So it really was a big process. And it took us a long time to get up to 100,000 patients, And the big scale up took place when we started to move across and said, no, nurses can do this, and that also was a bit of a process. Nurses could do this, and counselors could diagnose. Counselors could make the diagnosis. We gained more confidence with the tests. We gained more confidence with the drugs. And nurses at primary healthcare clinics started to initiate the therapy, and we realized that was safe. And now we're in the era where we're saying even pharmacists must be able to prescribe these drugs. And I think this is a whole transition to saying the drugs are so safe and so good that we should be trying to get them to the lowest level possible.
So clearly making that shift from a very high level of health workers such as a doctor to lower levels such as nurses and pharmacists has helped us to make these drugs more accessible and to put more people on treatment. Do you think we'll see the same benefits in the case of psychiatric drugs?
I hope so. I mean, we still have a situation where mental health is grossly underdiagnosed and grossly undertreated. And we need to be pushing these therapeutics into the hands of people who are able to firstly diagnose and secondly be able to dish these things out. We don't have nearly enough doctors in this country. We don't have enough nurses, to be quite honest. But if we keep saying it's going to be left in the hands of the highest tier of medical care, it means the people who need them are not going to get access to them in the private sector and in the public sector. So we really need the same approach to mental health that we have to HIV. And I think that's what HIV has taught a lot of chronic diseases.
If we make these, as you say, therapeutics or antidepressants or anxiety drugs more accessible, isn't there a danger that it can be abused?
People are often concerned about this, and I think you just need to be sensible. You need to look at which drugs you're dealing with. What are the dangers? All drugs have side effects. You look at them and you say, what are the benefits to the society and what are the harms? And you're good with the training with the people who are handing them out. And you say, this is what the indications are for. ARVs are a very good example. I think the same thing needs to be done with each crop of mental health drugs. And some of them do have problems with them that need to be put in the right hands. And perhaps that's a group that there might be ones that only rest in the hands of psychiatrists. There's some that might need to be only handed out by doctors, but there are many that can be handed out by lower tiers of medical staff that can safely hand them out and people can get a lot of benefit from.
Francois Venter, thanks very much for sharing your insights.
Thank you.
Living with a chronic condition can be tough on the body, but it's also tough on the mind. And making it possible for nurses to prescribe mental health medication might just make that journey a little bit easier. That's your Health Beat. Until next time, goodbye.